Trauma-informed care provides an opportunity for individuals to receive the healthcare that they are seeking in spaces that are safe. I highly encourage every provider to start their intake with the question, do you feel safe? And how can we make you feel safe? And that is the beginning and the basis of creating a trauma-informed care practice. It's very important as providers to make sure that we're educating and preparing our clients well before the appointment so that they have the opportunity to prepare themselves and bring who they need in order to be ready for the visit, but also making sure that we're available and willing to honor their no if they change their mind when they arrive for their appointment.
I ask all new patients about a trauma history, and of course, whether patients want to disclose that or not, entirely up to them. But it is a part of my practice, and I'm always so surprised by how many patients kind of like step back and say, wow, no provider has ever asked me that before.
Additionally, sit down. If all you're doing is standing and going to the computer, we all know that creates a wall that needs to be broken. Also, ask them about themselves at first. How did they hear about you? Why are they there? And more importantly, what's important to them? I also think, even though it does take probably about additionally 20 seconds, to ask them why they're there. It's amazing. They've done studies. Patients can tell you everything you need to know in usually less than 60 to 120 seconds.
When I establish rapport with a new patient, it's really important for me to be able to earn the trust and have the patient understand that I am going to be a safe person for them to be vulnerable, honest, and authentic with in the room. I like to talk to them with their clothes on before we have any state of undress or examination.
Sit down with them and talk to them about what they can expect. What the entire process is going to look like is really important. Take time, pause, ask if there are any questions. Give time for the questions. Sometimes people are nervous about speaking to someone in power because they feel like asking a question is questioning them. Get consent and ask, are there places that, as I've talked about this procedure, that you would be uncomfortable with me touching? Ask that. They may not know that that's an option. So that's really helpful. If there's something that that the patient does not want to have done, talk about what some alternatives could be.
So for example, if someone received a PAP and they felt harmed in that PAP, what we would be doing in their experience with me is really talking step by step in not only what happens in the PAP, but what are the tools used? Where would it happen? And in the best possible scenarios, giving them as many choices and options in each piece of that. What that looks like is laying all of the equipment out before an exam or a procedure, having the patient client touch each item and feel it in their hands and hear what it sounds like if there's a sound attached to it.
There is the incredible clinician guide for trauma-informed care that gives you both scripts and the reason behind why we do this.